I think that I can leave to my colleagues the desire to do research, the desire to discover new things, and to desire to practice honestly, to practice without risk, without danger for the patient, because I come from the medical school. I know, and this is still valid, that the patient is the center of the therapeutic treatment, of the therapy, and we cannot forget the individuals. When, as a doctor or as a dentist, we have to take care of them. When I finished my high school, I have this great passion, the football, and I played as a goalkeeper in a little team in Florence, and after that I had a good success, and I spent 1 year in Sampdoria of Genova. I played in the professional team for about 1 year. And my father convinced me to come back in Florence, trying to continue our study and try to play in a more close city, just to allow for me for studying and playing. Therefore, I come back to Florence, and I spent a few time in Fiorentina team, but there are famous goalkeepers such as Giuliano Sarti, Enrico Albertosi. It was impossible to to take their position in the team of Fiorentina. And I used to continue to play in the smallest teams around Florence, close to Siena or close to De Luca. And therefore I continued to play until 1978. I was about 35 years old. And I think that this activity was very favorable for my life, because I used to wake up early in the morning, about 5, studying, and after that I used to go to the university. In the afternoon I used to go to play for a couple of hours, and I come back in my office, and after that I continue my studies. In 1965 I got my degree in medicine, and I started my activity in the Department of General Pathology, University of Florence, because I was always interested in medical research. And that was a very nice moment of my life, because I understand how research can be performed in general medicine. After that, 1 year later, I went and moved to the dental school. And I got my specialization degree in 1968. When I moved from the Department of General Pathology, University of Florence, in the dental school, University of Florence, I find a very strange situation, because in that period, in Italy, periodontology was almost inexistent. The disease was considered hereditable and untreatable, and large gingivectomy were performed to remove the diseased gums, and the clean were superficially cleaned. But reading the journal, the book that are available at the time, it was difficult to have this book and the journals. I started to understand that periodontology was a very intelligent material branch of the dentistry, and that the knowledge on this subject was very advanced in the North America and in Europe. Therefore, I started my study on my own, and I realized that after having understood the principle of periodontal disease is diagnosis and its treatment, I started to try to perform my first flap and my first graft. I used to go in the morning in the department. I used to go to the I have some person who helped me, and I did many flaps in the front area, in the lateral area, but I started this activity as a self-touch practitioner. So I try everything of the solution, doing large flap, short flap, vertical releasing incision, non-vertical releasing incisions, the removal of the granulation tissue. And so I start to understand that the complete removal of the granulation tissue, the infected cementum, gave me the opportunity to verify all that I read on the journal. The periodontal disease was treated, if treated correctly, may provide a periodontal health also in our patients. As regard to the free gingival graft, at the beginning I understand that some individuals have some difficulty in cleaning the teeth, especially in the front area, in the low incisor, in mandibular incisors. And I start to design my first graft. And at that moment, I start with the epithelial connective tissue graft. They are very large and very thick, and the outcomes were successfully from the functional point of view, but was absolutely an aesthetic result of the procedure. And therefore, I start to use only connective tissue graft. I have more success from the aesthetical point of view, but sometimes big necrosis of the exposed tissue gave me the opportunity to consider that this procedure was not possible in any situation. I did probably many mistakes, but they became very useful during my long activity because I had no control at that time. So I did incredible, unbelievable mistakes. But considering the outcomes, I slowly I tried to improve my surgery, my surgical approach. And that was very helpful. Performing this procedure, I think I had a good idea to save the measurement, periodontal measurement data from my previous surgical approaches. And saving this material, I realized that after many years, now I am an old man, analyzing and reevaluating this data, I am able to write long-term results of our approaches and to verify and to evaluate their effectiveness. And this is very interesting, and I suggest to young people to save their data that in the future will be absolutely necessary for evaluating our activity. During my activity, I realized that the general dentist they had no idea of periodontal diseases. They removed the teeth, they substituted with partial removable dentures, and the patients were happy for that. It was very difficult on the beginning to teach to our colleagues, our dentists, that periodontology is really efficient in the treatment of we call in Italy piorrea, of the periodontitis. And at the beginning, they are very suspicious to send us the patients. But after a few years, they understand that it was possible really to save these teeth. And they send us to the department an unbelievable number of patients. At that time, I treated the severe aggressive periodontal diseases, every kind of disease in young patients, old patients, localized periodontal abscesses, necrotized gingivitis. So I increased my experience. Meanwhile, my clinical experience in Florence, some of other colleagues, Gianno Ricci, Gianfranco Carnevale, Giorgio Fogel, went for their specialization in the United States. When they come back in the 1965, they provide our community interesting information on the periodontitis. That was very helpful because it's a new stone for the building of this castle. And altogether, we succeed in different sides of Italy to improve the knowledge on the periodontology. For economical reason and because I was in the department as a former position as an assistant professor, I could not go for having a specialization, a degree in the United States. Later on, in the 1980s, I went sometimes in Boston in the office of Jerry Kramer and Mario Nevitz, who were friends of mine, and I started to understand the more sophisticated technique of the periodontal procedure. After that, I went also in Rochester, New York, in the Department of Periodontology. At the time, it was Zender, Paulson, and Caton. They were friends of mine, and I understand how the animal research, were performed in that department. And that was also an additional increase of my activity. In the 1980, my best student, Sandro Cortellini, got his degree in dentistry in my department. He was very nice, very intelligent. I consider a kind of young brother. And along with another friend of mine, Carlo Claus, who is an oral surgeon, we start our long and still ongoing collaboration that is based mainly on friendship and mutual respect. And this is really the key of our success. When I moved to University of Siena as the chairman of that department, Sandro followed me because we are a very close couple person. And along with a young doctor that I found in Siena, Francesco Cairo, Roberto Rotundo, Michele Nieri, we expand our group and we studied several aspects of periodontology, starting from regeneration, mucogingival problems, the problems related to orthopedic in young patients, and so on. We continue our studies. Sandro, at the time, helped me to make the procedure. He was very clever, very intelligent, and he solved many of our problems. And at that time, Maurizio Tonetti was graduated in Italy, in the department University of Siena. I was a chairman, and Sandro was at the beginning an assistant professor. And the other people, because of the economic problems of the university, Michele Nieri, Roberto Tundo, Francesco Caio, voluntary doctors that used to come in our department every day, just helping us for the procedure. The problem in Italian university was very serious at that time, also in this time, but it was very difficult. But I think that our group was supported by this intense interest in doing research, in understanding, and as Italian person, we would like to fill the gap between us and the similar colleagues in the United States and in Europe. And that was really a big effort. At that time, all our studies were supported by ourselves because the procedure were performed in the university, sometimes in our private practice. We pay for the animal experiment. We did by ourselves histology. Maurizio Tonetti and Michele Nieri were good statisticians, so we saved a lot of money that was impossible at that period to fund. I spent 13 years in Siena, and I go back in Florence, at the University of Florence, I became the chairman of the department and the dean of dental school. Therefore, we continued to our research together, but Sandro was completely outside, and along with Maurizio Tonetti, they started the collaboration in Berna in dental school. That Klaus, the director of this was Klaus Lang, and they did fantastic studies. And sometimes I used to join them in Bern, and we spent a couple of days together studying, writing articles. And Klaus was very happy, and he used to be our host in his mountain house, and it was a very pleasant period. As a chairman of periodontology, and after that, dean of the school, I was a full-time professor. So I used to spend all my time at the university, but I saved a couple of afternoons in my private office just to perform visits and some elective procedures. A colleague of mine, Dr. Cristina Magnani, supported this office, my office, allowed for me just to maintain my position in the university. I think that there's quite a difference between these two activities, clinical activities. Obviously, in the university, we took care of number of patients. Every day, we are able to visit 10, 15 individuals every morning. And we can treat them absolutely with the best procedure. But sometimes in the public situation it's difficult to follow this patient for a long period of time, because many of these people come from other towns, other cities, other counties, and sometimes it was difficult to have a continuous support in periodontal care and evaluating the results. In the private office it was quite different. Surely I treated only selected patients, but the positive thing is that we can also follow them monthly, every 3 months, every 6 months, for a long period of time, and for this reason I have the data of this patient demonstrating or not the outcomes that we reached. I like to be a teacher, and really, I think that I prefer to teach to the students, especially in the FAR 98, the importance of the anatomy and physiology of our tissue, and also to make them understand that the most important thing is to have a great respect of the person, because a patient is the center of the therapeutic pathway, and that we have respect for the patient, and that all the procedure should be done only without risk for his or her situation, and nothing must be done just to try a procedure, but the procedure should be adapted to the necessity of that patient. And this, I think, is a moral consideration that has to be taken into consideration in our activity, in our profession. In addition, I am a professional football trainer, coach, because when I finish my my football activity, I take this degree, and I am a football coach, and also I have a specialization in medicine of sport. And now I am the vice president of Italian Committee of Anti-Doping Agency. Lot of activity.